We're doing a Radiance blue peel on Jennifer. We were already started because it takes a little bit of time. And what we've done so far is we've already put the peel on. She's only got about 1 minute and 45 seconds left. It frosts because it's got salicylic, glycolic, and lactic. So you see it's already got a white frost on. We're going to neutralize in just a minute. Then we're going to do an ice ball, which is cryogenic therapy, also known as dry ice. So you'll get to see that. But this is the blue peel. So she's used it. And then we're going to show you the whole process of how it's taken off, the ice ball, the cryogenic, and all the serums that we need to do afterwards. This is great for all skin types because it's got all 3 acids in it. It's going to help with fine lines and wrinkles, pigmentation, stimulating the collagen, elasticity in the skin. It's wonderful for all ages. So everyone is a great candidate for it. It's really probably not stinging anymore, is it? Yeah, it kind of really neutralizes itself after the beginning. At first it really does have a little sting, tingle, but then it starts cooling off. Get the neutralizer. So we have about 20 seconds. And I use the neutralizer even though it's probably not really stinging, just so all clients feel a little bit better. She's got 4 seconds. We wipe it off. And sometimes it does sting a little bit when you're wiping it off. And then I come back with just some cold water. Just to make sure everything is off. Once we do that, I just get all the clients to keep fanning while I'm getting the little ice ball ready. So the ice ball, which like I said is cryogenic therapy, also known as dry ice, it is actually anti-inflammatory and antibacterial. So it's going to get any redness and inflammation out of the skin. And being antibacterial, if you have an acne patient, it is great for breakouts to help those. So it's great afterwards to calm the skin and just make sure the skin is dry completely. You cover the patient's eyes to make sure nothing gets in their eyes. And then you always move constantly. You never let it sit still on the patient's face. And you move fast. But it helps to really get that redness out of the skin and help calm the skin down. Then we're going to finish up with serums. Always put a phytocorrective, which helps with calming and hydration. Has a green tint, which helps with the redness in the skin. It's got hyaluronic acid, which is a hydrator. Then I put Florentin CF, which is a vitamin C. It is an antioxidant, which helps with fine lines and wrinkles, brown spots. It's a natural sunscreen, not a replacement for sunscreen at all, but added protection. One of the best things you can use for your skin. Helps to lighten pigmentation on the skin. If you don't have it in your skincare routine, you should. I use some Hydrate, which is your moisturizer. And then we're going to finish up with our New Derm sunscreen, SPF 50, for some sun protection. Always put your sunscreen on. We do not want any kind of sun on our skin after doing a chemical peel. Wear that protection, so anything that you lighten after a chemical peel, you're not going to get reverse reaction. As you work hard to lighten these brown spots, they can come right back, and we don't want that to happen. So keep that protection on. So she may be a little bit pink for the next 30 minutes to an hour, but that should subside. And she should be good to go. She can go back to normal routine. You don't want to work out for the next, 24 hours. If she sweats or gets active, it could tingle again. But that's really her only restriction. But besides that, she's good to go. She can put her makeup back on, once all this dries. So thanks for joining us. That was a little bit of showing you how we do one of our chemical peels, which was the blue peel Radiance.
Jennifer, how did it feel?
Wonderful.